Hi, it's Dr. Clark, and I'm here with my friend Doreen. Tell me about what was going on with your shoulder. Now, you had a right shoulder problem, right?
Right.
Tell me how that started and what happened, okay?
Okay. So it was about 6 months ago. I started having right shoulder pain, and it kind of came out of the blue. There was no injury or anything like that, but it was progressively getting more painful. It's keeping me up at night, almost all night long.
Right.
Restricted
That's
range
tough.
of motion.
Yeah.
I couldn't, it was becoming really debilitating very quickly. So I couldn't reach behind me, I couldn't wash my hair, I couldn't put on anything over my head. I mean, it was really painful. So I started going to different doctors. I went to a sports medicine doctor, I went to an orthopedist, I went to 2 other chiropractors, and they all agreed that I had frozen shoulder, where there's a lot of scar tissue that builds up in there, and it's very painful. And I tried a couple physical therapists, it just made it worse. And the orthopedist said I needed to have a MUA, manipulation under anesthesia, where basically they put you under and just force your arm, you know,
Yeah.
like just force it
I
to
understand.
break up the adhesions. But it had a low rate of success
Yeah.
and a high rate of complications.
Yeah.
So I was kind of determined to keep finding other things. So I just kept Googling people.
Thank God for Google, right?
and I did, though. In the meantime, though, I scheduled the surgery because I was so miserable,
Yeah.
and the surgery was like maybe a month out. So I'm like, better schedule it because I can't live like this. And then I just happened to come across an ad for you that said,
What
you know,
timing?
yeah, it was like a nominal fee for an exam,
Yeah.
X-rays, and 3 treatments. And I said, what do I have to lose?
Right.
So I came here, and then the second treatment we did, the Trigenics therapy,
Yes.
and it was miraculous.
Yes.
Everything that I tried, I could not get one more degree of range of motion. And within one treatment, I had maybe, I don't know, maybe 30 more.
30, 40 degrees. We're
Yeah,
gonna post
one
those
treatment.
pictures if you don't
It's-
mind. I'm
oh,
gonna
God.
post the difference just on the first
Or on my face. on the
treatment
palm of my face. Yeah, no,
that we did.
it was like amazing. And then, you know, the second treatment I had with the Trigenics, again, more range of motion, and I was already almost pain-free and sleeping through the night.
Wow.
After going through
Yeah.
months,
2 treatments.
2 treatments. It was like, it was just, and the people around me like, what happened? Like, how could this be? Because, you know, it's a completely different person.
So let me make sure I understand this, okay? So you went to, well, 2 other chiropractors.
Went to 2 other
Is it-
chiropractors, and I
One or
went
2
to,
medical doctors.
I went to, sports medicine doctor, MD, and I also went to an orthopedist who was supposed to be like the best orthopedist in all of Houston, who treats all the,
Yeah.
you know, pro athletes and everything. And he was
Yeah.
the one who said I needed to have the surgery.
And then you tried a couple of physical therapists and none of that improved, and then in 2
No, it
treatments.
made it worse, honestly. The physical therapy just aggravated it and made me in more pain.
Isn't it shocking to you that something could really be that simple, but
Yeah.
doing the right thing makes
No,
such a
it's-
huge difference?
It's amazing. And the treatment itself, I mean, it just feels almost like deep tissue
Yeah.
massage or something, or trigger point work. It's, you know, it's not.
It's not comfortable, right?
Honestly,
But
it feels good because you
Oh,
feel
does it?
it.
Okay, good.
Well, when you're
Something like
doing
that,
it,
yeah.
it's kind of painful, but then it frees you up, and
Yes.
to
It's
to
a
get
good type of discomfort.
to get the motion again feels good.
Well,
So, yeah.
in fairness now, okay, so there were some other things that we did, okay, that were critical in this case, and
Yeah.
important for, if somebody's watching this and you got frozen shoulder, I'm gonna tell you, Doreen's an amazing case, okay? We get amazing results in the first 2 treatments, and that's why we, a lot of times will say, hey, if we don't improve your condition at all within 2 treatments, I won't accept your case,
Yeah.
because that's how confident I am that we can do that. But in her case, there was a neck component, which nobody had addressed yet.
Right.
The nerve in the neck was pinched, affecting the shoulder, the muscles in the shoulder. Of course, she had all this frozen shoulder stuff because this thing had been going on for months and really years to some degree. And then we used some other therapies like laser, and we used some PMF treatments
Yeah.
to help just healing damaged tissue. But
Yeah.
now, but show me what your range of motion is now.
Yeah, which range of motion?
Just
okay,
go up
so
to the
look,
side.
I can go all the way like this. When I
That's
first
crazy.
came here, I was like this.
Yeah, 90, not even quite 90
If
degrees.
that, if
Yeah.
that.
Now,
what are
now
some
you
others?
couldn't get back here at
Oh,
all.
no, I couldn't.
Yeah.
I could barely like touch the back of my butt here.
Mhm.
And now it's like, I can go all the way up here like this.
Yeah, that's
I'm-
helpful, isn't it?
Yeah, no, it was I couldn't even put, like, right now I have my hair in a ponytail, I couldn't do this.
Oh,
I
yeah.
couldn't do that, I couldn't put a t-shirt on, I had to put like button-down shirts on.
Yeah.
And, you know,
That's crazy.
no, it was horrible. It
Yeah,
was
going
horrible.
up this way, you couldn't do that at
No,
first either. Now that's no problem.
now it's like easy breezy.
That's amazing.
No, I mean, if anyone has had frozen shoulder, it's actually considered one of the most painful
I
conditions.
agree with that.
And I didn't really even know how much it affected people, and I joined like this message board on Facebook,
Mhm.
and I try to tell people, hey, you need to come here. And I don't know why they don't, because it's,
People have a hard time believing your story, but we
They
get
do.
to see it week after week after week, and don't listen
you
to
can
whatever.
talk to my physical therapist, because they were the ones, like, they couldn't even, like, try to move it passively.
Oh, yeah.
They're like, no, it's stuck.
Yeah.
Like, it was like, you know, moving a boulder or something. There was no way to move it. That's why, to me, and honestly, I tried to force it several times because I was just so determined,
Mhm.
and, I couldn't.
Yeah. So the thing is, and here's the amazing thing, is that what the doc said to you was somewhat true. There are some adhesions and fibrosis in there, but that wasn't the majority of your problem. Because if that were the case, it wouldn't be able to turn around in one visit or two visits like that.
Yeah,
You understand? It was a neurologic problem.
right.
And most people at home are thinking, there's no way this can happen. That's because you don't understand what's causing the problem. And once we got the nerve connected back to the muscle,
Yeah.
it started to release, and all of a sudden it moved, and it stopped hurting so bad.
Well, and I can say, you know, being in the treatment room, there's several other people here who've had frozen shoulder or rotator cuff, and they tell me the same thing. We're all
It
experiencing the same thing. Yeah, it works amazingly, and I mean, I wish that more people just would know about it.
Thank you
because
for sharing your story, and thank you
Yeah.
for telling those people that are out there suffering, because you are right. I deal with all kinds of chronic conditions.
Yeah,
Peripheral neuropathies, I deal with fibromyalgia, I mean, you name it. This is the most painful condition as far as joint and musculoskeletal problems go I've ever seen. And people that suffer with this, they suffer horribly. So I
oh,
thank
no,
God that you're doing better.
it was within a few months, it was turning me into a different person, whereas, like, how can I live like this? I mean, it's just like,
It's depressing.
it's very, yeah, and then literally within less than a week, I'm back to myself. I'm like, the old me is back. It
It's
was
exciting.
just amazing, yeah. So,
Congratulations. Thank you
Well,
for your hard
thank
work
you.
and your
No.
diligence. You did,
Thank you.
you
That's-
got here when I told you to, you did what I asked, and it's paid off.
yeah, well,
Yeah.
this is a great place, and everybody here is really caring, and they really, you know, they explain everything, and just the therapies that you have are cutting edge, you
Yeah.
know, like the PMF
That
and
makes a
stuff like
difference,
that,
yeah. Now, for time schedule, just so you got an idea, you started with us, how long total have you been at it now? Let's see,
Jeez, I
we've
don't
had like
know.
maybe 3 weeks,
Maybe,
three,
yeah.
3 or 4 weeks.
Yeah, and
because-
I had to take
because
some
she's
time off because I was on
rehabilitating.
vacation.
Yeah, so we've had
But-
about really 3 weeks of treatment now.
Yeah,
Okay, and she's been rehabilitating this, because you get pain relief doesn't necessarily mean now that it's rehabilitated to the point
No,
where
I
it's
still
gonna
have
stay
to-
that way for the rest of her life. And
Right.
ultimately, that's the long-term goal, is
Yeah.
that you never ever deal with this again.
oh, no, I'm sold, I'm willing to do what it takes, because, you
I
know,
know you are.
but to be out of pain and to be able to do this,
Correct.
you know, now, I mean, I literally, for my job, I have to travel. I wasn't able to be in the car for very long, because it was just holding the wheel, was painful.
Yeah.
And now I've gotten my life back.
So
and
you
I
got
can
your
re-
sleep back, you got your work back, you got your enjoyment in life back.
Yes, and,
Thank God, that's
Yep.
wonderful.
no, it's amazing.
Thank you so much, Doreen, and thank y'all for watching. God bless.